I just started the recording and I'm going to share the presentation. Hi, Marilyn, welcome. So we're going to get started, and anybody else who comes in later can catch the replay, because it's a very packed masterclass and I want to make sure that you get all the information out of it. So you both obviously know what the masterclass is about. It's about weight and PCOS. I'm going to start by introducing myself for those who don't know me. A few people who have registered have worked with me in the past. Some have done my 10-week PCOS course, and some people are completely new. I'm Marie-Isabel. I'm from the island of Malta. My first degree is in pharmacy. I graduated as a pharmacist in 2008 from the University of Malta. In 2010, I got my first master's degree in toxicology and drug design from the University of Groningen in the Netherlands. After that, I worked for a few years in a pharmaceutical company and then in community pharmacy. And throughout my work in community pharmacy, I struggled a lot with an eating disorder. When I had gotten to the point that I was 150 kilos, I decided that I needed to do something about my health and my eating disorder. So I sold my pharmacy and I started first dealing with my own eating disorder, and then realizing that there was very little help in this area. I started a master's in eating disorder recovery and neuroplasticity. And throughout my course, I found out that 75% of women with PCOS actually develop binge eating disorder. And it's a huge part of PCOS. I did my master thesis on PCOS, and that's when my interest in PCOS started. Since then, I got certified as a nutrition coach, as an intuitive eating coach, and an NLP practitioner and a breathwork facilitator. And I decided that I wanted to delve into the world of PCOS a lot more, because I realized that when you get your PCOS under control, everything else, all the issues, whether with food or anxiety or self-esteem, they fall into place because it's related to a lot of different things. So since then, I've started my qualifications as a nutritionist as well. I was diagnosed with PCOS at 19, by the way. And when I got diagnosed, it was very much a run-of-the-mill diagnosis. You have PCOS, take the pill, take metformin, come back to see me when you decide you want to have children. And nothing ever came from it. Nobody ever really bothered to see the link between a lot of other conditions that I suffered from and PCOS. And basically, that is what I am here for. So we're going to start with this masterclass. So we're going to first start with the root causes of what leads to the weight, and then we're going to go into the nutrition for PCOS and weight loss later in the masterclass. But if there's definitely one thing I want you to take away from this 2-hour masterclass, it's that weight is actually a symptom of your PCOS. It is not the cause. So if people tell you, if you lose weight, all your symptoms will go away, it's actually the other way around. You do have the weight because of the symptoms. So yes, losing weight may or may not improve other symptoms, because the bottom line is that the root causes of what's causing all your other symptoms is probably responsible for your weight as well. And I really want to make sure that you understand that your weight did not cause your PCOS symptoms, and weight is a symptom in itself, just like irregular cycles are a symptom, and acne is a symptom, and hirsutism is a symptom. And the same root causes that are responsible for your symptoms are responsible for your difficulty in losing weight. So by addressing these root causes, weight will actually start to shift gradually as your symptoms also improve. And actually, this is why it took me such a long time to create this masterclass, because a lot of people used to tell me, why don't you focus more on weight? The problem with weight is that you actually need to learn more about all of your root causes to be able to address the weight. And a 2-hour masterclass is literally just going to scratch the surface. And literally, we are just scratching the surface today, but I'm sure that the information that I'm going to share is going to be interesting for all of you. So let's start by talking about weight. It's a bit of a controversial topic. A lot of people on social media will tell you shouldn't be discussing weight loss. But as someone who has lived a big part of my life in a bigger body, I know a lot of the difficulties that come with being in a larger body. One of which is actually being shamed by doctors and healthcare professionals who will, if you go in for a sore throat, they will tell you to lose weight. If you go in for an infected toe, they will tell you to lose weight. Everything is related to your weight. Sometimes women are even refused certain tests. They will tell them, lose weight before we do these tests. And especially when it comes to fertility, a lot of women are turned away because of weight. And I find this to be something that is very unfair. And I'm sure that anybody who's here has at some point experienced this. I do want to point out that if you have a history of eating disorders, deliberate weight loss might not be the appropriate treatment for you unless you have been on a good, unless your eating disorder has significantly improved and you are in control. So before starting any diet with any history of eating disorders, I want you to be very, very much aware. So having said that, research does support that even a small amount of weight loss can positively impact your PCOS symptoms and your PCOS markers. Unfortunately, we don't yet know if it was the weight loss that actually improves the symptoms or the change in lifestyle that improves the symptoms. However, I do want to tell you one thing. For those who do know me a little bit, you know that I'm very much a feminist, and I believe that this is your body and your choice. So I want to give you all the information you can to make a decision for yourself and do it safely, whether you want to lose the weight or you don't. But having said that, studies show that even losing just 5% of your body weight can make a huge difference in your symptoms. I'm going to share by sharing the story of one of my clients. This is Louisa. Louisa is a yoga instructor. She's from Ireland and she owns a yoga studio. After she hit 40, her weight started creeping up slowly. Her cravings were all over the place and she was finding that teaching yoga was becoming really difficult for her because her weight went up to 112 kilos and she couldn't do certain movements. Her wrist was really painful when doing certain things, her hips hurt. So she actually wanted to get back to a weight where she felt at her best, and that was at 82 kilos. The weight that she chose was a weight that was achievable. It wasn't too out of this world. And she had a very good relationship with food for the past 10 years. However, despite having a good relationship with food and being a fit person because she's a yoga instructor, her weight kept on increasing, and this was affecting her ability to work with her clients. So we worked together. We've been working together for the past 6 months. We got her insulin resistance under control. And we are improving her gut health because we found that those two were her major drivers. And she started losing around 2.5 kilos a month. And till now, she is down to 96 kilos. So she's not yet at her target weight, but in 6 months, she went down from 112 to 96 kilos, which is fantastic. She's doing it slowly. She's working on her root causes and she's improving them. So let's start by looking at the root causes of PCOS. And I have to start from here because, as I mentioned in the beginning, weight is a symptom and not a cause. So let's start. These are the 4 root causes of PCOS. The first being insulin resistance. I'm going to be explaining in detail what each root cause means, okay? The first being insulin resistance, the second inflammation, the third hormone dysregulation, and the fourth gut imbalance. Something that many people don't know is that PCOS is actually a metabolic syndrome. It is not a gynecological syndrome. So your gynecologist is not the best person to treat your PCOS because it's actually a lot more complex than just being put on the pill. And the most common cause is actually insulin resistance. We know that for sure that 95% of women have some form of insulin resistance, whether they are living in a bigger body or in a leaner body. And what I generally tell my patients is assume that you are insulin resistant until proven otherwise. Inflammation is also a big root cause, and I'm going to take myself as an example. It is the biggest driver in my PCOS. I've done all the tests. We're going to look into that as well. Hormonal dysregulation, I'm sure you're aware of this. Testosterone effects, getting acne, hirsutism, belly fat, and this is also affected by stress, which also leads to a stress hormone being dysregulated. And finally, we know that the gut microbiome, the health of the bacteria that we have in our gut, is also a huge part of PCOS. So we're going to just scratch the surface of these. In my 10-week course, we actually spend 2 weeks on each root cause because they are really, really important. And we're going to start with how PCOS root causes actually affect weight. So when your body thinks it's in a fed state, so it is being fed, it is really impossible to actually lose weight. Why? When your insulin levels are high, your insulin is a fat storing hormone, and it is completely impossible for you to use that fat that you have in your body as fuel. Inflammation does the same thing. It leads to more carb cravings, which leads to more insulin resistance, which leads to more fat storage. Having a gut microbiome disturbance also has an effect on our weight. Why? Because it affects the way you break down and use carbs. It affects the way your blood sugar balance works. It affects your mood, your energy, and most importantly, it affects your digestion. If you are either constipated or you suffer from regular diarrhea, this actually, both of them can result in an increase in weight. And then there is the hormonal imbalance. We all know about the high androgens, the high testosterone, and androgens are anabolic. Think of a bodybuilder. Bodybuilders take anabolic steroids for what? To build up, for them to put on muscle. Now, in our case, when we have high androgens, this results in our body growing. And generally, unfortunately, it's the fat cells that tend to grow. Apart from that, 35% of women with PCOS also have thyroid issues. And thyroid slows down your metabolism. So, as you can see, every single root cause of PCOS leads to an effect on your weight. We're going to start by going through all of them one by one. We're going to start with insulin resistance. I'm sure you've heard this word before since you're diagnosed with PCOS, but you might not understand exactly what it is. And as I mentioned, it's believed that around 95% of women with PCOS have insulin resistance, whether they're lean or not. We are thinking now that it might be even higher than 95%. So what is insulin resistance? What happens in our body with the insulin? Insulin is, I want you to think of insulin as a key. Insulin unlocks the doors to your cells. Once it unlocks the doors, the cells open up and they are able to take sugar from your bloodstream to be able to use for energy. What happens in insulin resistance? In insulin resistance, unfortunately, this system does not work. So basically, if you eat any form of carbs, whether it's bread, rice, pasta, fruit, beans, pizza, or donuts, all of them are broken in your gut into sugar. It can take your gut anywhere between 15 minutes to 1.5 or 2 hours to break them down. However, the end result is the same. It is broken down into sugar. The sugar gets absorbed into your bloodstream. It's flowing through your blood, and it needs to be taken up by your cells to be able to be used for energy. So what happens is your brain detects that there is a lot of sugar in your blood, and our brain doesn't like that. It likes to maintain a very stable blood sugar. So it signals to your pancreas to produce insulin. And your pancreas immediately secretes this hormone. As I mentioned, the role of insulin is to open up the door to your cells to allow your cells to use your insulin. Unfortunately, people who have insulin resistance are that key doesn't match that lock completely. So the insulin is not really able to open this door up. It's knocking on the door, trying to get someone on the inside to listen to it and open up so it could let the sugar in. What happens? Your brain senses that your sugar levels are still high. It signals to your pancreas again to release more insulin, and you end up with an overload of insulin, your cells still being non-receptive, and insulin is a fat-storing hormone. So what happens? This sugar ends up being stored as fat, and your cells are basically starving because they are not getting that sugar from the food that you've eaten. So you get cravings very quickly after you eat. Many people, you would get hungry again after 5-6 hours of eating. But if you have insulin resistance, you find yourself feeling hungry an hour or even 2 hours or maybe even less after eating. And what do you crave? You crave high carb items, high sugar items, because your cells know that that item is going to give it a quick amount of energy. Now, we know that in women with PCOS, and also in men who have the metabolic side of PCOS, and then people who are either pregnant or getting older, because insulin resistance is not something just for PCOS, it's something that we find in as we're growing older or when we get pregnant, we find that insulin resistance increases. However, in women with PCOS, we know that there is a genetic defect with the receptor on the cells, and this makes us insulin resistant. So this is not something that you caused or is your fault because you used to eat too much sweets when you were young. This is something that actually is a genetic defect on our insulin receptor in all of our cells. So what does this mean? It means that the majority of women with PCOS, again, no matter what their weight, suffer from this. Now we get to the ovaries. The ovaries are really, really sensitive to insulin. So it takes the other cells about an hour to open up to insulin, whereas the ovaries will open up much quicker, and they will let a lot of sugar in to start producing your androgens, your testosterone, and so on. Unfortunately, because we have so much insulin in our system, the ovaries will produce even more testosterone and so on. So what happens? The symptoms coming from the androgens, so the acne, the hirsutism, the belly fat. I don't know if any of you struggle with getting rid of that belly. This is all related, again, to two root causes now. It's related to the insulin resistance, which is driving your hormonal imbalance. So basically, what happens in people with insulin resistance is that you eat, your blood floods with sugar, it floods with insulin. Insulin is not being used, so you store the sugar as fat, and you get loads of cravings, and basically you put on lots of weight. And then it has the other effects on your hormones, and it also affects your gut health and your inflammation as well. So what do we know? We know that this insulin resistance is very typical in women with PCOS. We also know that insulin is excessively produced when you have more fat. But we can still find it in both lean and overweight women with PCOS. It's increased with age, and it's increased with weight as well. So the higher the amount of fat cells, the higher the insulin resistance. And now, basically, I'm going to explain why it is so difficult for us to actually lose weight. So basically, your body, our body, everyone, not just women with PCOS, exists in two states. It's either in the fed state or in the fasted state. So the fed state happens the first 4 hours after a meal. At this point, the goal of your body is to store food. So you have your blood glucose going high, your insulin being produced because you've eaten, and your pancreas is making more insulin to help your body break down the food that you ate. And your primary goal is to take that excess fuel and store it as glycogen in your muscles and in your liver. And the rest is stored as fat wherever we store our fat. Some people store it in their belly, some in their thighs. And this is done just in case we need to use it later. After 4 hours, everything goes in reverse. We are in fasted state. So your blood sugar starts to drop, your insulin becomes low, and this triggers your body to go to your stores and break them down and use them for energy. So our primary store is the fat that we have around our body, and this is used in the fasted state to give us energy and to maintain our blood sugar. And this is actually why we can live for a long time without eating. So we exist in these two states. Now, if you are getting cravings very quickly and eating more regularly, you are going to remain in this fed state for longer. And this means that your body can never really access the stores that you have stored in your body. And this is why it's so tough to actually lose the weight. Now we're going to look at the second root cause, which is inflammation. So what is inflammation? Inflammation is a normal, healthy response to injury or to infection. We need it. We need this to happen because if you cut your finger or you sprain your ankle, we need your body to be able to heal where you have an injury. So inflammation brings blood flow to that area. There is redness, there is pain, there is swelling, and it helps your body heal itself. That is called acute inflammation. Then we have chronic inflammation, and chronic inflammation, this becomes a problem. It's when your body is constantly inflamed. It means that your immune system is working on overtime, and your body thinks that there is an injury somewhere going on all the time. And this eventually can lead to autoimmune conditions like celiacs, ulcerative colitis. It can lead to heart disease, to diabetes, and to aging complications. In fact, we sometimes refer to them as premature aging or inflammaging. Now, how does inflammation and PCOS fit in together? Inflammation plays a huge role in PCOS because PCOS itself is a chronic condition that leads to inflammation. The higher your body is producing cytokines. They are inflammatory markers that we find in our body. It's producing cytokines as a result of the PCOS. And this leads to chronic inflammation. There is cell signaling abnormalities, oxidative stress, and your body is constantly in an inflamed mode. Unfortunately, PCOS also changes how fat cells function. So fat cells function in a way in people who don't have PCOS, and in a different way in those with PCOS. So PCOS fat cells are more responsive to glucose and saturated fat, so they put on weight more quickly. And they also make more inflammatory cytokines. So our fat cells actually drive the inflammation. More inflammation drives more fat gain. And also there is a huge amount of leptin and adiponectin, it's called, that are produced by the fat cells. And basically, leptin tells your brain that you are full, adiponectin tells your brain that you are hungry. Unfortunately, in people with PCOS, in women with PCOS, this doesn't quite work that way. So if you ever get this feeling like you're constantly hungry and constantly want to eat, it's because your fat cells have screwed up how they produce leptin and adiponectin, and it keeps giving your brain signals to keep eating more. And this leads to binge eating. And here comes the relationship between PCOS and binge eating disorder. If we eat inflammatory foods, or this makes it even worse, and we're going to be discussing a little bit about inflammatory foods. And our fat cells also make inflammatory fatty acids, which also then lead to the production of more male hormones, of more androgens, which then lead to the acne, the hirsutism, the belly fat, and so on. So as you can see, everything is interrelated. Excess body fat makes inflammatory markers. So all women should aim for around 25% of body fat to be able to ovulate, 25 to 30% of body fat. If you have a higher body fat than that, then your body fat is making inflammatory markers. This is well established, it's been well studied. The more fat cells you have, the more inflammation you have in your body. Inflammation leads to more fat storage, it leads to more hunger, and basically it is this vicious cycle. So you try and lose weight, but this inflammation is working against you. And this can be even checked out through an inflammatory marker that you can test in the lab. It's called HSCRP. And this HSCRP is actually floating around in your bloodstream, and this leads to high cholesterol, and basically it ends up being a whole mess in our system. So now we're moving on to the third root cause, which is hormonal imbalance. And we know that hormones can affect weight. This is something that can happen, that affects weight in everyone, not just in people with PCOS. And many hormones have an effect on weight. So if you have low thyroid, whether that is TSH, thyroid stimulating hormone, T4 or T3, this can lead to an issue with weight. Now, regular labs can only study TSH and T4. The rest of the thyroid panel, and over here I've only mentioned 3, but there are around 7 thyroid panels, are not studied by regular markers. So you might think that your thyroid is okay, but it's not okay just yet. High cortisol and high DHEA, these are both stress hormones. The higher your stress hormones, the higher your fat storage. Then we have testosterone, which is also anabolic. So as we mentioned in the beginning, testosterone and DHT, they make things grow, so they make you put on weight. Then we have the insulin, which we've mentioned already in the part that we discussed, insulin resistance. Then we have our high leptin and low adiponectin, which we've already mentioned. This comes from our fat cells. And then finally, we have our sex hormones. So we have our estrogen and progesterone. The more estrogen you have, this promotes fat storage. And the less progesterone you have, the more progesterone you have, this promotes fat burning. Unfortunately, in PCOS, we find many women have high estrogen and low progesterone. And especially if you're not ovulating and you're not having a cycle every 28 days, it means that you are being exposed to estrogen for a longer amount of time. And this is why many women, as soon as they go into menopause or they're starting menopause, they tend to put on weight because their body is exposed to much more estrogen than it is progesterone. And estrogen is fat storing, whereas progesterone is fat burning. So, and finally, we're going to just briefly mention the gut microbiome. Gut microbiome is basically all the bacteria, all the microorganisms, because it's not just bacteria. We find viruses, we find fungi that are present in our gut. And to this day, we still don't understand a lot of it. So there is still a lot of studies being done in the area. However, some very interesting research is coming out. And as we learn more about gut microbiome, we are thinking that it is probably the major driver in PCOS. We do know that women with PCOS have a completely different microbiome to women without PCOS. That has been established by a study. And we also know that the gut microbiome in women with PCOS digest food in a different way. And because they digest food differently, this affects your energy. This is why many women with PCOS complain of fatigue all the time. It affects your mood as well as your carbohydrate and fat metabolism. So I don't know if you've ever met someone or if you're one of those persons who say that whenever you look at food, you put on weight. This could be one of the reasons. It's because of the little bacteria that we have in our gut. And so, as you can see, all the root causes of PCOS lead to weight gain. And this is why you need to get your root causes under control to be able to control your weight. Now, why might you want to lose weight? There might be different reasons why you would want to lose weight. Some women I know because they would like to have access to fertility care and IVF. Others would like to get healthier before they get pregnant. Some want to reduce their risk of diabetes, heart disease, and other conditions. Some of them are having a lot of symptoms of estrogen dominance. Others want an improved quality of life. They want to be able to travel and hike or to run. And some want it for a cosmetic reason because they want to feel good. And all of these things are completely valid as well. And of course, there is confidence as well. Even with the fact that you lose 2 or 3 kilos, that helps you feel better about yourself. Whatever the reason that you might want to lose weight, this is why I'm here today, to empower you with some tools to help you get there. So what does science say about PCOS and weight loss? So there's been quite a few studies that have indicated that being obese worsens insulin resistance, it worsens inflammation, it worsens hormone balance, and it leads to poorer fertility outcomes. And I've discussed a little bit of the results in the past few slides. We do know that weight loss is associated with improvement in quality of life. So depression and anxiety becomes less as soon as the weight goes down because the hormones are better controlled, fertility is improved, hair quality is improved, skin quality is improved. 62% of women who lose 5% of their body weight are able to start ovulating after 5% weight loss. And you can increase your possibility of having a live birth by 25%. So a lot of studies show that yes, weight loss impacts quality of life with PCOS well. However, we also know, according to the international expert guidelines on PCOS, that there is no one diet that works any better than the other in PCOS. And in fact, diets can actually lead to weight gain in PCOS. And we're going to see why and what to do about that. And before we get started, I want to emphasize that there is no perfect diet and there is no perfect body. And I know that there is a lot of things going on social media and you want to look a certain way, especially for those of you here that are younger in age. But I want you to keep that in mind. So we're going to, by keeping that in mind, I want you to actually set a realistic goal and a realistic rate of loss. Sometimes I see people who tell me they want to lose 60 kilos in 3 months. That is not realistic and it is not sustainable. And I also want to point out that actually body composition matters more than the number on the scale. BMI is completely crap, and I'm going to explain why as well. And yo-yo diets make the situation worse. So today that you've attended this masterclass, I want it to be the first day of your mindset change when it comes to PCOS and weight loss. We're going to look at a very realistic way of doing it, but it's going to take a little bit longer than most. However, it will also mean a long-lasting weight loss. I do want to again point out that the perfect body doesn't really exist and the perfect body changes with time. I remember when I was younger, the perfect body was the skinny girl with no hips and no boobs. And back then, I had an amazing figure that today would be considered a Kardashian body, but back then it wasn't. And I can guarantee that the pendulum will swing again in the future. So what is considered the perfect body is always going to change. So I want you to do this for yourself and not for what other people expect. Finally, I know there are a couple of ladies who are a little bit older doing this training. I want you to also keep in mind that bodies are actually expected to change with age. This is something that is supposed to happen. A lot of things are not the same from when we were 16, and our body is different as well. So we're going to start with realistic goals. And a realistic goal would be to lose 5% of your body weight. Now, after this masterclass, I'm going to be sending you a 40-page booklet, which contains a lot of information, recipes, and a lot of help where it comes to your journey to losing weight with PCOS. And on, I believe, the second or the third page, you have a goal setting page. So a realistic goal would be losing 5% of your body weight. So let's say you weigh 115 kilos. A realistic weight loss to aim for is 6 kilos right now. And I know it might not sound like a lot to you, but for your mindset and for your hormones, 5% is enough to already see a huge benefit in your health outcomes. So if you aim to lose 0.25 to 0.5 kilos per week, in 12 weeks, you should lose that 5%, which already makes your health better. That makes it 12 kilos in 6 months and over 20 kilos in a year, which is a very decent amount of weight to lose, and it's done in the right way. And that's the kind of weight you want to lose to keep it off. I also want to again highlight that fat and muscle take up different room, a different amount of space in your body. Over here, we have 3 kilos of fat and 3 kilos of muscle. They weigh exactly the same, but they look completely different, and they take up, the fat obviously takes up a lot more space. Apart from that, obviously muscle also burns more calories than fat, And increasing your muscle also improves your insulin resistance, your glucose uptake. So I don't want you to be focusing just on the number on the scale. Focus on the whole experience. And I'm actually going to show you a photo of someone, um, and she changed her appearance and her health in a matter of a year and a half, whilst only losing 1.5 kilos. So I want you to take off the pressure of the scales and put a focus on how it feels. And I'm going to start off the rest of this masterclass by talking about BMI. The BMI is something that's used to shame people many times, and it really shouldn't. Why? Because it is crap. It was developed in the 1800s by a Belgian astronomer for white men. BMI is worked by getting your weight in kilos, dividing it by your height in meters squared, and you get this number. And for some reason, doctors and insurance companies have been using this number as a measure of health. However, this fails in a lot of cases. In fact, the American and British armies have both stopped using BMI because all of their soldiers who were extremely fit were turning out to be obese. Because obviously muscle weighs more than fat, and even though they were super healthy and fit, the BMI was being off the chart. It was actually never intended to be used in clinical practice. And when he developed it, because this was developed for an economic reason during a time when scarcity was an issue. And he actually wrote down, if you find the paper, he actually wrote down this should not be used as a measure of health. So it was never intended to be used in clinical practice. And furthermore, it does not make sense in women because women are meant to have more fat than men. You need to have at least 24% of fat to be able to have an ovulation. So that in its own right already makes BMI crap. And to prove it, these women over here all have the same BMI. And as you can see, we are ranging from a size 10 to a size 18, and they are still having the same BMI. So someone who is very tall and slim might still be considered to be overweight or obese because of the fact that she's taller, for example. Okay, so let's get started on yo-yo diets. I know you've been on yo-yo diets before. I've done a million yo-yo diets myself. And this is the typical year for someone with PCOS. January comes around, you set a New Year's resolution, and you start keto. Within the first month, you lose 9 kilos, feel amazing, that's great, you're singing keto's praises to everyone. Please know that the first time around, that the first kilos in keto are probably water weight. As soon as you start eating again, you put on all the weight and a little bit more. March comes around and you think, okay, I've put on more weight than I started the year with. Let's try another diet. And you might try Whole30 or Paleo or Dukan, whatever you find out there. And you do lose a little bit of weight in 2 months. You lose 6 kilos. Please note that you already are losing less than you did the first time around because your metabolism has been compromised. Summer starts coming around, you start eating ice creams and you start letting go a little bit, and the weight goes back up, 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 up. Cravings keep increasing. And you find yourself in July up to 117 kilos. You think, okay, it's barbecue season. I'm barbecuing lots of meat and sausages. Might as well go keto again. You start keto again, lose 9 kilos in 2 months this time instead of 1 month. So in January, it was already much more effective than it is now in July. Summer is ending. You get tired of whatever diet you're doing. Your inflammatory markers start shooting through the roof because you are giving your body lots of fat, and your weight creeps back up, 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 up. You come to Christmas time, nobody wants to be on a diet during the holidays, and guess what? New Year comes around, and in 1 year, you've been on 3 diets and you've actually gained 13 kilos. On the other hand, if you focus on losing 0.25 kilos to 0.5 kilos a week over a year, you can actually lose over 20 kilos, and it's done really slowly and really efficiently. If you take the slow and steady rate, it's a lot better for you and it's a lot more realistic. So let's talk about what's realistic for you. And this really depends on your goal and your reasons why. Like the client that I've mentioned in the beginning, Louisa, she wanted to lose X amount of weight because of her job, because she was not able to perform on her job anymore because her wrist was hurting. So someone else might need to lose X more amount of weight because they want to have a baby. And somebody else just wants to feel good and more confident in their body. So what is a healthy weight? A healthy weight is a weight you can maintain without restrictive dieting or without spending hours in the gym. There was a time in my life where I used to spend over 5 hours in the gym a day. I used to wake up at 3:30 in the morning to be at the gym at 4 o'clock, work out till 6:30, go to work, spend the full day at work, and then go back to the gym. And this was not sustainable for a long time. So a healthy weight is a weight you can maintain without restriction or without consuming yourself. The majority of your diet should still be nourishing. You shouldn't be stressing out because you are on a diet or thinking, oh, it's the weekend, so I get to cheat. I'm on holiday, so I get to binge. I'm eating out, so I get to binge, I get to cheat. It shouldn't be this way. It should be easier. And this is a good thing because it means that you're going to lose the weight very slowly and you'll get where you need to be. And I just want to remind you that at the end of your life, if you spend your life obsessing about weight, the end of your life, nobody's going to say, oh, we miss her. She was an amazing person, but she could have lost 5 kilos. Nobody's going to say that. So focus on living and loving your life. So I'm going to be sending you that booklet, as I mentioned, and I want you to really sit down and think of what is your why. Why are you doing this? Why is this important for you? Write it down in the booklet, print out that page and write it down. And what's a realistic goal for you? If you want to private message me on Facebook, if we're friends, or if we're not, add me on Facebook and let me know what's your goal. Let me know if I can support you in any way further from this point. So now we're going to dive in to nutrition for weight loss. And I'm going to let you take a few deep breaths because we're going to get started with something that is quite interesting. So for those who have worked with me in the past or are working with me right now, you know that I always mention that every meal shouldn't be a PFF meal. What does that mean? Every meal should contain protein, fat, and fiber. This is something that you should include in everything you eat: breakfast, lunch, dinner, and snacks. And now we're going to start with the plate method and the PCOS plate method, to be more exact. So this plate method over here is for weight maintenance. So for those who want to keep on living a healthy life with PCOS at the weight that they are without putting on weight. And this is a very easy way to eyeball your plate and make sure that you are eating enough nutrients whilst maintaining a healthy weight. So basically, half of your plate should be starchy vegetables. These include things like mushrooms, aubergines, broccoli, cabbage, carrots, spinach, and so on. 1/4 of your plate should be protein. So And we are talking about good quality protein. I'm going to go through all the different sections in the coming slides. And another quarter of your plate should be carbs. And you want to keep it to 1/4, and you want to try and focus on less processed carbs. So we're talking things like grains, brown bread, brown rice, beans, fruits, starchy vegetables like potatoes and sweet potato and beetroots and corn. And once your plate is done, you need to make sure that you have an amount of healthy fat over there. So, starchy vegetables, I think this is one of the most common mistakes I see that people do. They don't eat half the plate full of vegetables, or they fill their plate with vegetables and they leave a good amount of that vegetables there. And you need to be sure to try and include throughout the day as many colors from the rainbow as you can. As the more you do this, the more your gut health is going to improve and your inflammation is going to improve. So we're going to be focusing on half of your plate being with non-starchy vegetables. There are the red non-starchy vegetables like tomatoes, radishes, and sweet peppers, the orange, carrots, peppers, pumpkin, yellow, the summer squash, onions, green. With green, we have loads to choose from. So it's broccoli or kale or lettuce, Brussels sprouts, cabbage, zucchini, you name it. Then we have the blue purple. So we have the eggplant and the purple cabbage. I'm really obsessed with the purple cabbage at the moment. I'm adding it into almost all of our meal. And we don't forget there's white and brown as well. So we've got cauliflower and mushrooms and bamboo, bean sprouts, onions, garlic. All of these things fall under white or brown. So you want to be sure that half of your plate is full of these. Now, what if you don't like vegetables? Sit down, start with a list of one thing that you like and one thing that you're willing to try. And every week you add on something else that you're willing to try. You might like it, you might not like it, you might be surprised. Maybe play around with how you cook it. Sometimes roasting can make something tastier than boiling. Whatever you choose, if you want to lose weight with PCOS, this is the first step. The next step is fill a quarter of your plate with a concentrated source of protein. And this could be fish, it could be shellfish, it could be meat, eggs, dairy, soy. For example, mushrooms, they contain protein, but it's not a concentrated source. So 1/4 of your plate needs to have a concentrated source of protein. And as I said, remember, this is for weight maintenance. Step 3, you fill up a quarter of your plate with carbs. And this is generally half a cup of carbs. So half a cup of rice, half a cup of barley, half a cup of bulgur wheat. If you're going to be cooking pasta, it's half a cup. If it's crackers, it's half a handful. Legumes, and these are superstars because they not only contain carbs, but they also have fiber and protein. Starchy vegetables, fruit, and alcohol. Now, in nutrition, we count alcohol as a different entity. For us, alcohol is counted as a carb. Alcohol actually has 7 calories per gram, whereas regular carbs have 4 calories per gram, but the effect of alcohol on your blood sugar is similar to carbs. So if you're having your glass of red wine, that would be your source of carb for that meal, and you would avoid the other sources of carbs. Why? Because this will increase your insulin resistance, and then everything else falls out of place. And step 4, and the most important step, and the step that a lot of people forget, is add 2 tablespoons of fat. So if you have your salad with your chicken breast and a lot of colors, and take a note and make sure that you have your source of fat, whether it is 2 tablespoons of olive oil or some nuts or olives or half an avocado or some nut butter. If you have a salmon salad, that will be different because salmon is high in fat in itself. Red meat and eggs, they also have an amount of fat in themselves. So now, as we mentioned, this is the standard plate. This is the plate for weight maintenance. Now we're going to look at the plate for weight loss. And this is a lower carb. It is not a keto. It is a lower carb. So half the plate still needs to be with starchy vegetables. This is a rule that you're going to have to try and stick to. At this point, you're going to increase your protein from half to between half and 3/4 of, from 1/4 to between 1/4 and half of the plate. So you're going to increase the amount of protein that you eat while still having the same amount of healthy fats. So your 2 tablespoons of olive oil, whatever we mentioned before. The lists here are exactly the same. Starchy carbs, protein, we're having a bit more, and fat, we're having, again, the healthy fats in the same amount. So basically, what this is missing is a source of concentrated carbs. You still have carbs in the form of vegetables, but a form of concentrated carbs. And if you want to lose weight in a healthy way, you can eat a regular plate with carbs once a day and 2 plates lower in carbs for the rest of your meals. So it is not about completely cutting out carbs. My only rule, and a lot of people who work with me know, is no lonely carbs. Even healthy ones, even if it's a banana, it's not to be eaten on its own. You need to make sure that it's eaten with protein, fat, and fiber. Why? Because lonely carbs will raise your blood sugar, which will raise your insulin, which then raises your testosterone and leads to irregular cycles. So, some tips for the plate method. The bulk of what you eat should come from nutrient-dense plants. Unlike the standard American diet, the protein is not the star of the show. Unlike keto, the fat is not the star of the show. But I want you to remember that no food is all off limits. So you are still including that 1 plate a day, which has an amount of carbs in it, which has your piece of brown bread or your little bit of brown pasta, and the 2 meals, which are less processed carbs and more plants. So it's just the proportions that are changing, and most situations will have options for you. So even if you are going out to eat, you'll definitely find something on the menu which has more vegetables and protein and less starchy carbs. And this is a very nice way to start getting that little bit of weight loss every week. Now let's talk about carb timing. So I want you to play around with the different amounts of carbs at different meals, at the meal that you're taking, which has carbs, and with the timing. Some people feel better eating their carbs earlier in the day. I, for example, don't. If I have carbs for lunch or breakfast, I am tired for the rest of the day. But if I don't have carbs for dinner, then that's the evening where I'm opening up the freezer, checking if there's ice cream left tonight. So for me, I need to have some carbs in the evening, and throughout the day, I stick to my vegetables, protein, and fat. Everybody is different, so play around, see what works for you. Research supports a better ability of our body to break down carbs eaten earlier in the day. But as I mentioned, everyone is different. If I were to have more carbs at lunch, I need to actually sleep for 2 hours, otherwise I can't function. And this is the beauty of individuality. We are all different, and it means it's up to you to decide how you feel, what feels better for you. So I want you to monitor, pay attention to your energy levels, to your fatigue, and how fast you get hungry. If you eat and you get hungry after 2 hours, it means that meal was not the correct one. Meal should be keeping you full and satisfied for 4 hours. So what do you need to add? Do you need to add some carbs? Do you need to add some protein? Do you need to add some more? Maybe you forgot to add your fats. There's no olive oil, no avocado in your salad today, and it wasn't satisfying enough. The only exception to no lonely carbs is when it comes to just before sports. So before sports, we want to keep the fat and the fiber as low as possible, because what happens, this will slow down the transition of fat and of food through your stomach, and that might limit your endurance. It might make you feel sick during food, and actually not food, during exercise. And actually studies have shown that eating a good amount of carbs an hour before a workout improves your endurance, which means you can have a better workout, which means you are more likely to build more muscle and burn more fat. So keep your pre-workout food low fiber, low fat. A little bit of protein is okay. For example, a bit of peanut butter on a rice cake, but low fat and low fiber. And these are some pre-exercise carb ideas that you can use. Half a banana, half a bagel, peanut butter and jelly sandwich, half a turkey or chicken sandwich, these oat bars, some apples or grapes, dried fruit. Now with dried fruit, we want to be a bit careful, the same as well as banana, because they tend to draw water into your gut. So they can make you bloated, and this can affect how you work out. And what do you eat after a meal? So between 45 to 60 minutes after a meal, sports nutrition says that this is the best time for your muscle to actually grow and burn more fat. So at this point, between 45 minutes to an hour after a workout, you want to be eating something which has a 4:1 ratio of carbs to protein, so something higher in carbs. And funnily enough, chocolate milk has this perfect ratio. In fact, athletes, when they are running a marathon or doing whatever their sport of choice is, they actually take chocolate milk after their workout until they get home in time for them to have a meal, because this allows for their muscle to actually develop better. If you can't eat after a training, which that is me, after I work out, there's no way I'm going to be eating until there's 3 hours have passed, you can have a smoothie or a shake to help replenish your appetite, but there is no real need to actually have protein or a protein shake if you actually feed yourself in this way. So, I want you to start learning more about how foods affect you. As I mentioned, there is no perfect diet and everybody is different. Why? Because all our root causes is different. There are over 25 women who registered for this masterclass. I can bet that each one of us has something that is different from the other in our root causes. I might have more inflammation. Someone else might have more insulin resistance. Someone else might not have much insulin resistance, but have hormonal dysregulation in your androgens. So and all of this affects how you feel when you eat. So when you are eating, when you are having something, ask yourself, how did this meal make me feel? How is my energy levels? This is how I realized that taking carbs earlier in the day does not work for me because it makes me tired. How long did this meal keep me full? Did it work for me or not? What happens if you tweak that meal by adding more carbs or reduce carbs? What about different type of carbs? What works best for me? Are beans better than grains for you, for example? My case, rice and potatoes are the two carbs that I look for. They're the two carbs that make me feel good. Any other carbs, they don't make me feel so good. Apart from the fact that I'm celiac, of course, so I have some restrictions, but what makes you feel best? And I do want you to consider whole grain, because actually whole grain, and we don't have time to get into this today, but whole grain has a lot of benefits for PCOS. So if you're taking a piece of bread, make sure that it's whole grain, go for the brown, same with the rice and the pasta. Now we're going to be talking about something that's very, very interesting, and it is resistant starch. So resistant starch is a type of carb that is not broken down in the digestive tract. It is a source of prebiotic, so it is food for your healthy gut bacteria. Studies have shown that people who consume resistant starch improve their insulin sensitivity, so this lowers their blood sugar levels, which means they have less cravings, and which means that they store less fat, which means that they are losing weight quicker. It also increases their feeling of fullness, which means that you are eating less because you're feeling more full with your meal. It's shown to improve cholesterol levels, and it also improves exercise tolerance and endurance. There is one particular study, so there are actually a few studies on resistant starch and PCOS. In one study, they took women with PCOS and they gave them glucomannan. Now, glucomannan comes from konjac. You might have never heard of it before. A good way of getting glucomannan or konjac is by buying the shirataki noodles. They are made from this. You find these in health stores or Asian stores. And 4 grams per day of glucomannan together with inositol, which is a supplement taken in PCOS, they found that every single woman in their study lost a significant amount of weight. In this study, they were measuring BMI, and their BMI improved significantly because they were consuming more glucomannan, which is one resistant starch. In another studies, women with PCOS were given dextrin, which is a synthetic form of resistant starch. And not only did it improve their weight, it also improved their menstrual cycle regularity and decreased facial hair significantly with no other changes. So what are some sources of resistant starch? Raw potato starch is one. Glucomannan, which I've just mentioned, it comes from konjac root. And you can find this in the form of shirataki noodles. So you can buy these shirataki noodles. I know that in some countries you can also find shirataki rice. And you can make this as one of your meals throughout the week to start increasing your resistant starch. Green bananas, I know this isn't particularly appealing, but bananas, when they're still green, they have a form of resistant starch. There's the lab-made ones, dextrin and high maize flour. Now, raw oats, this is something that's really easy to get into your diet, either through overnight oats or putting them into your smoothie. For example, that's what I did this morning. I had my smoothie, I added my 2 tablespoons of raw oats, I blended it with my smoothie, and I had my amount of resistant starch in the morning. Another way of getting resistant starch is really, really interesting, and it is to cook and cool certain foods. So if you cook these foods that are mentioned here, potatoes, pastas, rice, and legumes, and you cool them in the fridge, what is formed is resistant starch. And you can experiment with this, especially now that summer is coming for those in summer regions. I know there are some people in Australia who are going into winter. But you can experiment with pasta salads and potato salads and rice salads, because this will actually help your weight loss. Now, when it comes to resistant starch, don't go from tomorrow and start including all forms of resistant starch into every single one of your meals. I want you to start slowly, because if you do that, this will cause bloating and a lot of digestive distress. I actually have seen in a client some very severe side effects to the shirataki noodles. She was eating them for lunch and dinner every single day, and she ended up having a very distended belly with some digestive issues. So we're gonna start adding these foods in very slowly throughout the week. There's no need to buy expensive supplements. Don't go out and buy glucosamine and supplements. They are actually not going to help, because they're too strong and they will cause side effects. Foods work just as well. So try a pasta salad once this week, a potato salad next week, overnight oats once, and it's going to help you get where you need to be. So when it comes to weight loss, protein, fat, and fiber is your foundation. You need to make sure you have this in your plates every day. Focus on eating more fiber, more protein, and more healthy fats, and more fermented foods like yogurts, sauerkraut, kefir. I actually found a really nice tasting kefir this week at the supermarket. It had ginger with it and it tasted really nice. And avoid less refined and processed carbs. Try and avoid too many added sugars and inflammatory fats. So if you want to focus on weight loss, I want you to consider eating 1 to 2 low carb meals a day and 1 meal a day which contains all the carbs, because this is important for certain root causes. So we don't want to completely eliminate all of the carbs. But if we're going to have carbs, we make sure that they are the healthier kinds. Protein is really, really important. And one of the biggest mistakes I see is people don't get enough protein for breakfast and lunch, and they eat a very top-heavy dinner with a lot of protein in the evening. The key for weight loss is to distribute your protein evenly throughout the day and not backload it. It's really, really important. So make sure that you are eating a good amount of protein. I would say increase according to how much you weigh. So 1 gram of protein per kilo. If you weigh 113 kilos, that's 113 grams to 250 grams a day of protein. It's within range. So we're talking around 45 grams of protein for lunch, for breakfast, lunch, and dinner, and around 25 grams of protein at your snack. The key is to distribute it throughout the day evenly. It's important to eat more fiber. Fiber fills you up, and it's also important for your gut health. And it's also linked to a better quality of life in polycystic ovaries. In fact, women following a Mediterranean diet, which is high in fruit and vegetables and whole grains, have also a better body composition, so they have more muscle versus fat. How much? I would recommend a minimum of 35 grams of fiber per day. Make sure that you are getting around 8 to 10 servings of vegetables and fruit. And I'm going to be insisting on vegetables a little bit more than fruit, because if you want to lose weight, again, if you want to lose weight, it's not about food maintenance. You need to reduce a little bit those carbs, those high carbs and fruit. You can have fruit with 1 meal, but don't have it with all 3 meals if you want to lose weight. Again, fat doesn't impact our blood sugar in any way. It fills you up and it has a satisfaction factor. Now, there have been studies done on women who do high-fat diets, and they have seen that there is a degree of weight loss, but this leads to issues with other root causes. So increased inflammation, increased insulin resistance, increased androgens. So we want to focus on the right kind of fats, the fats that we've mentioned in the beginning. We're talking about olives, avocados, olive oil, salmon, nuts, and so on. How much really varies according to the person and how much you can tolerate, or how much you are binging at the moment. If you're binging more, let's add a little bit more healthy fats throughout the day to avoid this binging. It's the way the brain works. But I would say aim to eat no less than 15% of your calories from fat, with the upper limit being 30%, not more than 30%. So between 50 to 30% of your daily calories would be from fat. And this is super important, eat more fermented foods to support your gut. So we're talking about Greek yogurts, not the yogurts with a ton of added sugar. So make sure you look at the labels and how much added sugar they have in them. Kefir, miso, tempeh, sauerkraut, sourdough. All of these are higher in fermented food, fermented bacteria, basically. So this gives more good gut bacteria into your system. And this allows you to actually control how you extract nutrients from food. People who have an overgrowth of the bad bacteria actually extract more fats from the food, extract more carbs from the food, and suffer from weight gain a lot more. So how much? 1 serving per day. Aim for 5 days a week, 7 days a week if you can. At the moment, I've made this into my daily ritual. So I have my snack at 4 p.m., which would be Greek yogurt with some blueberries and nut butter. And that's my intake of fermented food. Once in a while, I take some kefir, or I make a nice stir fry with some tempeh, or I have miso soup. So I mix it up a little bit. Kombucha is also an option. It's fermented tea. You can actually find it for sale in quite a few different places. And that is also a nice way of getting more healthy bacteria into your gut. I want you to, again, if you're focusing on weight loss, eat less refined carbs and added sugar. So if you're going for refined carbs, anything with white flour, try and avoid, and instead replace with whole grain. So whether it's a wrap, or it's a piece of bread, or some pasta, or baked goods, try and make it more whole grain. Even things that you consider healthy. So sometimes I see these ads for these so-called healthy cookies, and they are made from white flour. For the case of PCOS, we want to avoid and try and take something which is higher, which is made of whole grain, basically. Be aware of your added sugar. I always tell my clients, focus on 25 grams of added sugar per day. So you can add a little bit of honey in your tea, but having Coca-Cola every single day is a different story, or going to a cafeteria and having a cappuccino full of sugars, or these sweetened syrups that they add in. I'm sorry, I don't drink any coffee, so I'm not familiar so much, but these things will minimize the spike and crash in your insulin and help balance out your sugars and help you reduce your insulin resistance and start burning more fat. And eat less inflammatory food. Omega-6 fats, which are found in processed vegetable oils, have a huge impact on inflammation. So you have the fried foods, your processed packaged foods like chips and cookies. These are really high in inflammatory fats, and this makes your inflammation worse. You know the drill. It makes everything in your PCOS worse. Consider baking or air frying in a Teflon-free brand. Why? Teflon, which is found in a lot of air fryers, including the one I used to have in my kitchen. I didn't know about this, but Teflon is an endocrine disruptor, and it can actually make your body store more fat. And I'm not saying never have fried foods, but really make them a treat. Let's be honest, we all know these foods don't support health and they don't support weight loss. But if you are going to avoid them completely, this sets you up for binging. So overall, you're going to be eating a PCOS plate. Once in a while, if you're out with your partner or with your friends and you're craving a little bit of fries, it's not the end of the world if you have your fries. Just don't make them lonely fries. Add some protein and some fiber. Order your fries together with some chicken breast and salad and enjoy your fries that way. How many carbs are too many carbs? And again, this is really, really individual. Some people do better having only one meal a day with very minimal carbs. Others feel more energy with including carbs at every meal. If you want to lose weight, you will have to find a balance between the amount of starchy carbs that you eat versus the carbs that are coming from vegetables. Now, low-carb diets have shown success in PCOS, but if you actually look through the study in detail, you realize what they refer to as low-carb is that 40% of the calories are coming from grains and starchy vegetables. And this is actually moderate carb. It has nothing to do with keto. It's a moderate carb diet where you are getting 100 grams of carbs a day, so around 400 calories from carbs, and everything else coming from protein, healthy fats, and fiber. Just going to remind you again, no lonely carbs. Your aim from here on out is to keep your blood glucose in range like it's your job. So always make sure you pair them with protein, fat, and fiber. How low is too low? Is there a too low? Yes. Less than 80 grams of carbs per day seems to be cause issues with hormones. So if you do eat less than 80 grams, this is not ideal because it gets you stuck in what is called as this limbo. So you are not in ketosis, but you don't have enough carbs for your brain to function. So you feel tired, you feel like you have brain fog, and it can lead to hypothalamic amenorrhea and issues with your thyroid gland and issues with your sex hormones. So if you're going to go on this way, you need to be eating around 80 grams of carbs per day. And don't forget to use food as medicine. There are actually some what I call magical carbs. So certain carbs have very little to no impact on blood sugar, and some actually improve it. Barley is one of them. It does contain gluten, so if you are celiac like me, you need to avoid it. But if you're not, barley can actually lead to weight loss. In PCOS, there is actually a study of someone in, I believe, around 250 women with PCOS, where they were given barley and oats to eat daily, and this actually led to a significant amount of weight loss. Legumes are also considered part of these magical carbs, so beans and pulses. You need to see what works best for you, what feels best on your body. And resistant starch, which we've mentioned already. So the konjac, the cooked and cooled potatoes and grains. Try and make these your primary source of carbs slowly. So as you start changing your lifestyle, you can have maybe a barley salad on a Monday, add some oats in your smoothie on a Tuesday, have a cold potato salad on a Wednesday, and that way you are adding in some resistant starch, but not every day, and eating other carbs which are healthy for your PCOS. Unfortunately, calories still count, but I don't want you counting calories because this puts you in a negative space, in a negative mindset, which in PCOS is really, really high. So forget about the 1,200 calorie per day diets. That's enough for a 2-year-old, actually. Focus on how your plate looks. Half of the plate with vegetables, 1/4 to 1/2 with protein, and a little bit of fat. I want you to remember that a low-calorie diet actually cuts your metabolism in half. There was a study, I always mention this with all of my clients. It's called the Biggest Loser study. I'm sure you've heard of it. And they found that these people lost a lot of weight, but when they did, they screwed up their metabolism so much that now eating 800 calories a day and they're still putting on weight. So remember that your bodies will hold weight if you are under eating for your needs. Your aim is to eat in calorie deficit without stressing your body out. So if you are 120 kilos, you might need to be eating 2,500 calories a day, 3,000 calories a day. This is completely realistic. You can work out how many you need. That's something that you can reach out to me. We can have a one-to-one session and work that out together if you want, or you can do it yourself if you know how. But if you should be eating 3,000 calories a day, eating 2,500 calories a day is still in a deficit. It's still realistic, and it still means that you will lose weight slowly. So err on the higher side and try and, of course, also get a little bit active. Now, macro balance, again, I don't want you to be counting macros, so focus on getting your protein, fat, and fiber in there. There is no need to be counting them. If you follow the PCOS plate method, this should be enough, and make sure that you're eating a PFF way. This should be enough to help give you lots of benefits and also have a huge impact on your blood sugar, insulin sensitivity, and weight. Skipping meals. Now, this is a topic that's very controversial. I get most of my clients asking me about intermittent fasting. Women's bodies in particular are very sensitive to scarcity. So our body's priority is to survive and to reproduce, whether if you want kids or not. That is your body's priority. So if you're skipping meals, and if there isn't enough nutrients available to sustain life and grow a baby, then your body is going to slow down your metabolism. It's going to slow down your sex hormone production. Your period is going to disappear, even if you are at a heavier weight. And this is actually proven by epigenetic studies. They've done studies on generations following wars, famine, and the Holocaust. And they found that when your grandmother was pregnant with your mother, you were already present in your mother's ovaries. So what your grandmother used to eat or didn't eat could still affect you today. And we have studies showing that those coming from such backgrounds, their bodies have actually been trained to use calories more efficiently and to hold on to weight and carry more weight. So you shouldn't be skipping meals, especially breakfast, because this is especially important. Do not underconsume calories or nutrients. And if you are premenopause, do not go longer than 12 hours without eating. If you are postmenopause, we can consider going up to 14 hours and seeing how it goes. But premenopause, You definitely cannot, because it will backfire, and it will backfire on your hormones, which will eventually lead to weight gain. Mindful eating, those who have been working with me or know me or following me for a while, you know I've done master classes on mindful eating. This is exceptionally important for your gut health. Eating slowly, breathing in between meals, making sure that you are taking your time, removing distractions from the table, actually chewing your food, because digestion starts in the mouth, using all of your senses, whether it's sight, taste, touch, smell, even sound. If something is crunchy, if something is sizzling, focus on these things. This will help make your gut healthier, which in turn leads to how much fat and carbs you take up, and it will affect your weight. If possible, put food on a plate, eat sitting down in a dedicated place, not in your car or at the sink or at the fridge or in your desk. So, what should your day look like in a nutshell? It should look something like this. We are talking about breakfast, which contain eggs as your source of protein, yogurt as a fermented food, some fruits and a little bit of tea or coffee. A lunch which has a lot of colorful vegetables, some good quality protein, good source of healthy fats, and a little bit of lentils as a good source, a good packed source of nutrients. As a snack, we're having 2 cubes of dark chocolate, some nuts, and an apple. So we have our fiber, our fat, a nice healthy snack. And dinner, we have our salmon together with our broccoli and purple cabbage and some sweet potato. And this is a nice, fully PCOS friendly dinner. Another example, we have the eggs, which you can make into an omelette and use some tomatoes and kale. If you're going to have a tea or coffee, try and avoid sugar. For lunch, again, you have your colorful salad. This time you've got tempeh, which is fermented form of soy. So you are getting your fermented source, which is good for your gut health, but it's also got protein. Your chickpeas, which also have a little bit of protein, some nuts, and some olive oil. And that's your healthy fats over there. As a snack, you have a protein bar, which is low in sugar. So you have your protein source over there, which has a little bit of fat in it as well, and your fiber source with some strawberries. And for dinner, you have some shirataki noodles with shrimp and different vegetables. And over here, you have one meal with refined carbs. So you have the noodles, and you have a nice planned out day, which looks good for your hormones, good for your health, and good for your weight loss. Again, another example, your eggs with different salsas in a wrap, for example, a different salad with some black bean soup, chicken and avocado, a piece of toast, because you might be craving some bread with peanut butter, and then have some Greek yogurt with a little bit of fruit with it, so that you are getting your fat and your fiber sources. And for dinner, you've got your steak with a huge amount of vegetables. And you have your resistant starch as well in the form of cooled and cooked and cooled potatoes. Now, I'm sorry this went longer than I expected, but I'm going to end quickly. We're going to talk a little bit about lifestyle. Despite what you may read online, when it comes for exercise for weight loss, more is better. So we're talking about 150 minutes of moderate to 75 minutes of intense for maintenance of weight. If we're talking about weight loss, it's 300 minutes of exercise, moderate exercise per week to 150 of intense. That's around 30 to 60 minutes of exercise 5 days a week. How to gauge your intensity, that's very personal. I have an Apple Watch, you can see it here in my hand. So I can gauge when I am actually doing exercise, if it is fat burning or not. You can base it on your heart rate, you can base it on your own perception of exertion. And if we go for some examples, moderate exercise would be walking, yoga, weightlifting, swimming, and dancing for fun. Intense would be running or those boot camp type classes, HIIT sort of workouts. The benefits of exercise for PCOS go well beyond weight. I'm sure you know this. It improves insulin sensitivity, it lowers glucose, it lowers testosterone and estrogen, it improves your body composition, lowers your inflammation, improves your metabolism, it helps you tone up, it may help fertility outcomes, it improves cholesterol, and my favorite one of all, it aids stress management. I can't tell you how stressed I was when we went into the first lockdown last year and I couldn't get my boxing gloves on at the gym and do my boxing class. It really affected my mental health. So studies in PCOS actually show that for weight loss, you need to do aerobic or cardio exercise between 45 to 60 minutes, 3 times a week for 12 weeks. And this led to 2.3% loss in body fat and improved insulin sensitivity. Weight training 3 times a week for 3 months. Yoga is actually very beneficial for hormones. So 60 minutes daily for 3 months actually improved insulin, glucose, and HOMA-IR versus conventional exercise. So basically all the markers that show increased in weight, so your insulin, your HOMA-IR, and your glucose can be affected by yoga. And of course, there's daily movement too. So if you are getting your steps in, if you are cleaning the house and active at work, all of these things still count. So the bottom line is try and do what you have access to and what you enjoy. Include some strength training in your routine. It can be body weight training. You get bonus points if it's something fun and you really enjoy doing it, or if it's out in nature because it helps reduce your stress levels. This is a sample exercise plan. Actually, I did not do this myself. A personal trainer who is specialized in hormonal balance did this for me. So on a Monday, you would do 30 minutes of weights and 30 minutes of cardio. On a Tuesday, you would do either a dance class or some yoga, something that is lighter and you enjoy. Wednesday, again, we're going weights and cardio. On Thursday, we either take a completely day off if you're not used to working out or do a little bit of yoga. Friday, again, weights and cardio. Saturday, we either take a rest day or we do something very light, like a leisurely walk or a leisurely jog, depending on your fitness levels. And on Sunday, you do something outdoor that's fun with your family or some yard work, whatever feels good mentally, more than to burn calories. Sleep, we've all heard if you don't sleep enough, then you are not going to lose weight. So if you want to wake up at 5 a.m. to work out, that's fine, but make sure you're getting your 8 to 9 hours of sleep because it's important for your insulin control and your blood sugar and your cortisol levels, which is your stress hormone. If you don't sleep enough, your cravings are also higher and you don't have enough energy to actually function. So your body is going to want to eat more. And of course, mindsets. In my opinion, and this is something that I've done myself, throw away the scale, Um, like a washed pot, weight loss happens when you're not locking. Your weight can fluctuate because of our cycle. So go by how you feel instead of what the scales say. Stop comparing yourself to others and follow social media accounts that make you feel bad. If you need to build coping skills, you can work with a therapist. You can try and address your emotional eating if that's an issue. Studies have actually shown benefits on weight in PCOS with cognitive behavioral therapy. And also, studies have shown that working with someone like me, or maybe a different nutritionist, or um, a different nutrition coach, for example, but having a support system, going through it with someone else, having a community actually helps with weight loss. Finally, I'm going to talk a little bit about the environment. I've mentioned Teflon in the beginning of this, earlier in this session. So you minimize your exposure to hormone disruptors, swap plastic for kitchen, for glass and steel, avoid non-stick cookware. All non-stick cookware contains Teflon. Teflon is a hormone disruptor. Sorry, I'm going to mute you. Um, Take care of what beauty products you're using on your skin and what you're washing with. Some of them may contain hormone disruptors as well. Try and filter your water, and be aware of what cleaning products that you use. One of my lecturers was actually doing research on flame retardants in cookware and how it affects weight gain. And he actually found a really big correlation between the flame retardants used on pots and pans and a good amount of weight difference of 15 kilos between people who use cookware with flame retardants versus people who don't. Even candles can affect your hormones, even body lotions with a lot of scents and fragrances can, so be aware of these things. Also, be aware that too much caffeine can increase your stress hormone, which leads to weight gain. So if you're a coffee drinker, try and stick to your one caffeinated drink a day, and then drink decaf coffee or switch to green tea or even spearmint tea, which has a lot of benefits for PCOS. If you're smoking cigarettes, and this is something that I like to point out, smoking cigarettes increases inflammation, so it doesn't help your PCOS, and it damages the gut. Thing is, when you stop smoking, your gut heals. And this is why people who are smokers tend to put on weight. It's because they start absorbing more nutrients than they would before. So if you're going to stop smoking, do it under the guidance of a professional who can actually guide you how to eat in a way that won't lead to weight gain. Vaping is something that's becoming more common these days. It also leads to hormone disrupting. Cannabis, it's becoming more legal around the world. This lowers inhibitions, and it also makes you crave more foods and more sugars. So it does lead to a little bit of weight gain because it make you eat food that you are not normally eating. And then, of course, there are the edibles with cannabis, like the chews and the lollipops, and you need to consider the added sugar in these. And excessive alcohol also has the same effect. So it lowers your inhibitions, it impacts your sleep, and makes you want to eat more. So this also affects your life. The last 3 slides, supplements. I always recommend inositol. 4 grams a day of my inositol for 14 weeks actually led to weight loss in a big study, whereas those not taking inositol actually gained weight. My recommendation is taking 2 grams in the morning and 2 grams in the evening. It is, however, contraindicated if you have bipolar disorder or mania. Carnitine is another supplement which is evidence-based. It helps metabolize fat, and in a study in PCOS, 250 milligrams a day for 12 weeks led to an average of 3 kilos weight loss in those 12 weeks versus around 200 grams of weight gain in the placebo group. And it works best when it's taken with a meal containing fats. Glucomannan, we've spoken about this already. Resistant starch, it promotes fullness, it feeds your good bacteria, it lowers cholesterol. Studies, not in PCOS this time, but studies have shown that it leads to around a 5 kilo weight loss in 5 weeks in combination with a healthy diet. However, I do recommend you use it with caution. As I said, it can result in extreme bloating. So I prefer if instead of taking glucomannan, you would resort to the potato or the pasta salad, or you might consider taking shirataki noodles instead of the glucomannan supplement. Okay, so that is our session on for weight loss. I hope you found it interesting. I'm going to remove this the presentation, and I'm going to open up the floor for questions if you have any. You can either unmute yourself or type in the chat, whatever works best for you.
Hi,
Hello.
hi everyone. Paula tax edha għatnindina jiġini schools.
Problema. Hi, Paula, kif inti?
Hi. Alright, alright. Tuħa saqsika il-Kambodġa melux xrajtu tejt nixorbu il-Kambodġa. Tejt xrajtu melux, I bought it recently. How much exactly? I was thinking of that would be my serving of fermented, something fermented. I'm not sure how much I should have.
Okay, so with kombucha, it really depends on the brand that you buy. So take a look at the label, see what's added into it. I wouldn't make it my only source of fermented item per week. So if you're going to have your large glass of kombucha today, tomorrow try and have some Greek yogurt, for example.
Yeah, I have kefir, I have other things, just to vary a bit.
Yes.
But I know it has some sugar as far as I know.
That is what you need to pay attention to. So as I mentioned, ideally you should stick to 25 grams of added sugar per day. So if you're having your kombucha, and added sugar doesn't include fruit and vegetables, by the way. So added sugar is something that is added to it. So if you're having your kombucha, let's say it has 8 grams of added sugar, be aware of what else you're adding to your food throughout the day. If you're using some salad dressing, which could have some added sugar, or if you're taking the protein bar, which could have some added sugar. For example, I'm going to give an example. So my mom was having this drink, and it was being marketed as something super healthy. So she thought she is doing something good while switching to this. And I was at her home. I was seeing in her fridge, and I told her, what are you drinking here? This drink had 45 grams of added sugar, and it's sold in the health section of supermarkets. So it's important to check the labels, see how much added sugar, and make sure that you don't go above 25 grams per day.
All right. And what would you recommend as the best kefir around? I can only find one make, although I've been to various supermarkets. I'm not sure if it's the best one again because of sugar content.
That's again another thing. So different countries, because we are people from different countries in this masterclass, have different brands. Since you happen to be from my country, I can send you a photo of the one that I'm using.
Right. Okay,
but again, look at the label.
So everywhere I've been, there's just this one make. I can't remember the name right now. And I'm pretty sure there are other brands around, but I can't seem to find. So
I actually came across recently 2 brands. One of them had 11 grams of added sugar, and the other one had 3 grams of added sugar.
There's a big difference.
Market. So there's a huge difference, especially if you want to try and control your blood sugar and your insulin resistance.
Uh-huh. And when you said the yogurt for a snack, how much yogurt? Like the usual small tub, or that's too much?
Again, that really depends on how active you are and how much you've eaten throughout the day. So in my case, normally I get around 75 minutes of exercise a day. So that means that I can push my
Uh-huh.
calories up a little bit more. And generally that's when I do it at snack time, because that's when I sort of get hungrier at 4 p.m. So
Uh-huh.
I add a little bit more. I have around 4 tablespoons because I buy the large tubs of Greek yogurt.
Uh-huh. Uh-huh.
Um, but
All
that
right.
depends on how much you've eaten. So if you've had a day where you're really hungry, and this can happen because hunger is something that's cyclical in everyone, not just in women. So it's cyclical in men as well.
Uh-huh.
You might have a day when you are more hungry and you've eaten more, so you want to maybe reduce a little bit, or you might have a day when you're less hungry and you've barely eaten anything. And then 4 p.m. hits and you're hungrier, so you're going to add a little bit
Uh-huh.
more yogurt. I don't want you to suffer hunger. Suffering hunger
Yeah.
means that you're not going to lose weight long term, you're going to end up binging.
Uh-huh. All right. And one last question. You mentioned glucoman and or dextrin.
Mhm.
Um, I'm in menopause. Is that still okay? Or
It's resistant starch. So I prefer if you take it in the food version rather than
uh-huh.
a supplement
Then that.
version.
Uh-huh.
So, but yes, it's not going to really affect menopause or not menopause. It's
Uh-huh.
resistant starch. It's a type of food for your gut bacteria, and it
Uh-huh.
actually promotes weight loss. So, if you're going to go for glucomannan, go for the shirataki noodles. Maybe
Uh-huh.
make a nice stir fry with vegetables and chicken or whatever meat
All
prefer,
right.
or tofu or whatever, and eat
Mhm.
it that way. Um, and the resistant starch comes in a lot of different forms. It's not just glucomannan. So as we mentioned, there's the oats, there's the cooled potatoes. All of them are beneficial for when it comes to weight, especially as we're growing older, because as we do grow older, and everybody here is growing older, whether you're 60 or
Uh-huh.
we're all getting older. But as we are getting older, our bodies naturally become more insulin resistant. So we want to
Mhm.
try and help our body out as much as we can.
Yeah. Um, uh, okay, I think with the oats, I managed to switch. I I didn't think I would manage. I'm drinking almond milk, and I found that I like it. So it has zero sugar as well. I found actually, I don't know for anyone that's used it, the unroasted one tastes better than the roasted. I don't know why, but it does taste better.
Everybody has their
Um,
personal preference. So
Le eżatt. Someone told me this and I thought unroasted and then I tried it and it was true for me as well. So anyway,
perfect.
that's it. Thank you, Bill.
No
Nice seeing
problem.
you again.
Any more questions, ladies? Eleanor? Yes.
Hello, I'm not sure if you covered this because my internet got broken and I couldn't listen to all of it. Maybe I will hear the recording as well. Not sure if you mentioned or not. You suggest the 3 hour window eating. I mean that we snack every 3 hours, or it's more fasting, which is suggested in PCOS cases. Thank you.
Um, Neither the 3 hour window nor the fasting. I spoke a little bit about fasting, and I spoke what I do recommend in PCOS is having something to eat every 4 to 5 hours. So generally that would look like 3 meals and one snack. So you would have lunch between breakfast between 4 to 5 hours later. You would have your lunch. So let's say you've had breakfast at 7, you have your lunch at 12:30, you have your snack at 4:30, 5 o'clock, And then you have your dinner, because it's a main meal, at 7:30, for example. But you shouldn't go longer than 4 to 5 hours without food, because this actually increases your cortisol. And cortisol is a fat storing hormone, and it's also related to all our beautiful side effects with androgens. So I don't recommend fasting, but I don't recommend every 3 hours either, because every 3 hours would result in having your blood sugar high all the time.
Thank you.
Any more questions?
Yes, I have a question, please. When you refer to the overnight oats, are you referring to the normal oats that you buy at the supermarket, like the ones that come in a tin or in a bag?
Okay, when it goes to about oats, there are different qualities of oats. So I would generally go with the rawer version of oats. So either rolled oats or the full size jumbo oats. You can find these, yes, in supermarkets or in health shops. Don't buy the ones with added flavors, because obviously they have added sugars and preservatives that affect your inflammation. So the brand that I buy is the raw rolled oats. I buy large bags. I mean, this large of them. Obviously, I'm more than one person in the household, so we all have from these oats. But make sure that they don't have any added sugar. If you're celiac, choose a gluten-free form. Oats are naturally gluten-free, but they could be produced in a facility where gluten is used. So if someone is celiac in the home, then you want to be aware of that, because it could lead to some gluten sensitivity issues. And just focus on that there is no added sugar. Otherwise, the rolled oats or the jumbo oats are the best way to go.
Okay. And I have another question. Well, I'm 33. I got diagnosed with PCOS when I was 26, and ironically I weighed much less back then, and my weight loss practically creeped on me during the past 3 years. I was doing my master's degree, always sitting down. Then COVID. I'm a lecturer, so I couldn't go to work, moving around the campus and so on. And every time I really try to lose weight, I have hunger cravings. I get impatient with all the cravings, being hungry, and I practically used to weigh some 67 kilos, and now I'm up to 83. And rather than losing weight, I ended up putting on more, even simply going to the gym. I was like, okay, what's going on here? And yes, I mean, I have noted quite a few of the things that you said. And sometimes you start thinking, but does this apply to me? Am I really PCO? Do I really have insulin resistance? Because the doctors used to tell me, no, you don't have insulin resistance. But the things that you were saying make me realize that I think I do have insulin resistance. So my question is this. I have an issue with portion control, for example, because you said you divide the plate into, so half the plate would be veg, then a quarter of it would be protein, and a quarter of it would be carbs. And if you're trying to lose weight, you would avoid like the pasta or the rice or the bread or whatever. Esther, my question is, how much is the right amount when you say a quarter of the plate should be protein? And are protein shakes good? Because I'm a person who doesn't like to eat meat, because I'm obsessed with animals. So dico col contria. So that's my question. Thank you.
On that. I do understand some people don't eat meat for ethical reasons. Fortunately, being vegetarian or vegan is not very helpful to control PCOS root causes, because we do need a certain amount of good quality protein.
Animal protein.
That it's not impossible. So if you are happy with eating soy, edamame, tofu, whole forms of whole forms of soy. Avoid the processed soy as much as possible. You can still somehow make it work, although it means sometimes in certain cases more calories, unfortunately, because high protein items that are plant-based, like quinoa, for example, you need to eat 5 cups of quinoa to be able to meet your protein requirements for a meal, which would
Then you would be increasing the carbs then.
exactly. So you need to be aware of this. Protein shakes, if you are buying a good quality protein shake with not much added sugar and much added preservatives, that is okay. Make sure it's a good quality one. I've seen some which people think are good quality and then are full.
But aren't. Okay.
So you need to be aware of that. I personally, especially for the sake of your gut, would recommend getting some protein from food sources. So if that has to be soy, miso, and tempeh because you don't eat anything, that can be one way. Eggs, if you do eat eggs, are also a good source. 4 eggs are around 24 grams of protein. So a nice mushroom omelette, for example, with some spinach and so on, could make a huge difference. So when it comes to quantities, I'm going to be sending you a booklet. In the booklet, recipes, and in the recipes you will have an idea of what
what's the right quantity.
What is the right quantities.
Okay.
However, this is something that you need to be doing long term because you have PCOS now, but you have PCOS till the end of your life. So now that you're 33 and when you're 50 and premenopausal, or when you're 70 and postmenopausal, PCOS, even though, for example, when we're in our menopause, our ovaries aren't, we're not ovulating anymore. PCOS is a metabolic condition. It's going to remain there.
Okay.
So try and see with your practice, start with the recipes, yes, but practice with your eyes, how a plate should look. And this is something that, trust me, you'll get there with practice, because I've had clients who have no knowledge whatsoever about nutrition, and they've gotten there slowly. So make sure that you fill up, and you need to fill up with half of the plate with your veggies, and make sure that they are different colored veggies. So it's not you buy a box of broccoli and you eat broccoli every single day for the next weeks. Try and mix it up. I'm going to give an example of our lunch today. So we had our chicken breast, we had broccoli, mushrooms, green peas, and carrots. That was mine. My fiance's, I added some potatoes because he has an active job. He needs to be eating more carbs. I will have my carbs in the evening because when I have them in the afternoon, they wipe me out. So, but in the evening, yes, I'm going to have my portion, my source of carbs. Today, it's going to be a little bit of brown rice. That's going to be my source of carbs. It depends on the day. But when it comes to carbs, I did mention, if you go back into the video, quantity, so you have half a cup. When it comes to protein and fiber, especially fiber, don't obsess about the quantities. If you're hungry and you want more broccoli, go ahead and have it. However, I want you to look at each meal with curiosity. If this meal made you hungry after 2 hours, what was missing? Do I need to have carbs for lunch instead of dinner, for example? Did I add fat? Did I eat enough good quality protein? Because shrimp and beef contain different amount of proteins. So you need to be focusing on the good quality. If we're going to be focusing on plant-based, as I mentioned, it's the soys. However, ideally, because soy is a source of phytoestrogens and many women with PCOS have estrogen dominance, I wouldn't recommend a soy more than 4 times a week. So if you're going
I
to
don't like it anyway, so so thank you. I mean, I'll try to go for the chicken, even though I hate myself for eating it. But listen, I mean, I think it's the healthiest source.
unfortunately, and I
Mhm.
do understand, believe me, because I'm also someone who is obsessed with animals. But unfortunately, it's really tough to have a good PCOS balanced plate and eat a vegan or vegetarian lifestyle.
Okay. Okay. Thank you.
No problem. Any other questions?
Maybe apart from the chicken breast, I don't know Ruth, but maybe she likes white fish. Oh, it's very important. But
Fish,
I don't know if she likes it. But uh-huh.
I
And
don't like fish.
wild, not farm
you don't like fish, it's okay.
I don't like fish, except for, the one that, except for the seafood that's really fattening and it's rich in cholesterol, like octopus and mussels and all other seafood. But yes, I don't like fish, so I still avoid that sort of food anyway. So, but thank you.
If you don't like fish, you don't like it. Fish has a lot of benefit for PCOS. We didn't mention that today. As you can see, it was a full block, a block full masterclass, and there was still a lot of things that I could mention. But eggs, dairy, maybe. For example, cottage cheese could be something you could add to a salad as a form of
As in ricotta.
However, if you have acne and issues with your skin, then there are other issues with dairy, which we're not going to today. So you'll see in the I've given you some sample recipes, and there are some which have less animal-based protein. So you'll see some examples. If you really want to minimize the meat-based protein, have one meal with your chicken, one meal have protein powder, and the other either protein powder or eggs, for example. Or
And when you say eggs, for example, when I was younger, they used to say that's more than 2 eggs daily, including the yellow part, the yolk. Yes, is yolk. Is like more than two is too much. Is that true, or is there an amount?
So the studies, the eggs have been a controversy in the nutrition world for a really long time. That used to be the case. Nowadays, studies are actually showing no real limit. So you can even go up to 12 if you want a day. The yolk is actually the most important part because it's the part that contains the protein, and so you really need to eat that. I would not recommend more than 4 a day.
Okay. So if you had to divide them, for example, 2 in the morning with breakfast and 2 in the evening with your dinner, is
that's okay-ish, but you need another source of protein because it's not enough for that meal.
It's not enough. Okay. All right.
If you're having 2 eggs, then you might want to add, I don't know, some quinoa or mushrooms that contain a little bit of protein as well. Beans, for example, that contain a little bit of proteins as well. Don't overdo it with the beans. Don't forget that they are the carbs that, especially if you're trying to lose weight, they are carbs. So we try and only include them in one meal. But make sure that in that meal, the 2 eggs are not the only source of protein, and you have something else added on.
Okay. All right. Thank you so much.
No problem.
Thank you.
Any more questions? Okay, it seems not. I hope you found this interesting. I would appreciate if you would leave a review of the masterclass either on my group or on my page. It would really help me out because I'm just starting out in this online world. I'm going to be sending you the recording. You'll probably receive it tomorrow because this is going to be a really long recording. It's going to take my computer a while to be able to process it and then upload it. I will be uploading it on YouTube as an unlisted video, and you will receive the link. You will only be able to access it with the link. So if you go on my YouTube channel and you lose the link, you won't be able to see it. So you will have the link for the video, but you will also have a link for a Google Drive to download the booklet that I made for you. And the booklet contains recipes. It contains an explanation of the PCOS plates. So all the diagrams that I showed you, they're going to be in the video. And they have some questions that you should sit down and answer. If you want to learn more about PCOS, I have a 10-week course where we go into detail about PCOS. And I will keep doing master classes maybe every month or every other month, getting into detail on different areas of PCOS, because it is such a huge condition that you can never stop learning about it. So keep following my page and reach out if you have any questions. Okay.
Thank you.
Thank you.